All right, well, thank you. That was three remarkable presentations. I think we heard a lot about several topics. And I'm just going to take a moment as the moderator for, I guess, Winston called it prerogative, moderator's prerogative to ask the first question. Of all the panelists, all three panelists talked about trauma in different ways. And I'm struck by both the conversation, or the use of that term, but also how far we need to go to be really trauma informed in the way that we tend to use that phrase now in human services. So, you know, we have trauma informed services throughout our healthcare industry, for instance. I'd like to hear from each of the speakers about have they had opportunities to bring trauma-informed principles into long-term recovery organizations, into wider policy planning and program development and community engagement, or is that sort of an ad hoc, and if you get it, you're lucky, and if you don't know it, you don't get it?
Yep. We were able to bring from the Trauma Institute, it's Karen Vanderloop-Lipsky at Tachico State from our Office of Continuing Education for a Saturday that she was able to talk with us. But it was also a matter of who was able to show up. We did it pretty early in our recovery process, and hopefully we'll be able to do something again. So it was really geared towards our K through 12 educators to see how to deal with trauma in their classrooms. And the room was packed, but I also know that there's a lot of people missing in the room that probably need the information a little bit more urgent than the people that were in the room that were going to apply it to curriculum down the road. So we were able to do that for our community.
I would say that there's been a fair amount of education, mostly directed at practitioners of wildfire community preparedness, disaster case managers from the local level, but a lot of that wasn't institutionalized in any kind of policy. In fact, I spent last year working to develop the Washington State Wildland Fire Strategic Plan, and that was not a recommendation that came up in that year-long process with 1,000 folks of engagement in a very fire-prone environment. So it's not something that's necessarily elevated itself to a policy level, at least in Washington State, but it is a definite conversation among practitioners, generally at the request, or at least initially, it was at the request of the survivors themselves, saying this is not the language you need to be using.
Byron, can I give you a chance to respond if you'd like?
Sure. For us, I think when we're having our discussions external to ACF and HHS, we've found some success in messaging that as compassion fatigue. It's not an established national policy yet, but in our operations in Puerto Rico after Hurricane Maria, in Miami-Dade, Monroe County, where the Florida Keys are after Irma, and then as well as Texas after Harvey, and then currently in California for the wildfires, what we've seen is a need to address the compassion fatigue, both of the voluntary organizations that spring up to support survivors, state and county, individuals that are supporting survivors, actual responders who in many cases do not think that they need to take care of their own mental health, expanding our mental health or behavioral health support to teachers, as well as the child care providers, down to the bus drivers and the individuals who serve the lunches and the lines, recognizing that in many cases they're the front lines in terms of interacting with children. So it's not a policy, but it has become a best practice for us. I think we've had to, perhaps as we do a little more digging and kind of identify some lessons learned, I think we haven't quite pinpointed when it's best to have that discussion. I think early on in the operation, when people are feeling running on adrenaline before they're running on fumes, and everyone is Butte County strong or whatever community strong. In many cases, people tell us that they don't need that support. But yes, addressing compassion fatigue and trauma it's become a part of our normal operations. We just have not socialized it as much as we need to.
Thank you. We'll take questions now from the floor.
So thank you all for your presentations. Megan, this is directed at you. I really like the description of the role that Chico University has played in coordinating research efforts. I'm wondering if you could speak about how you've involved the community in some of those upper level priority settings. So, what came to mind is, I don't think you need every researcher, group of researchers coming in and asking, so what do you need? I'm wondering if the community has identified with the university a set of needs. Same thing with identifying vulnerable populations. What I think is vulnerable really might not be reflective of how the community sees and identifies what that vulnerability is. So I think the overall question is, how is the community involved in those overarching coordinating efforts that Chico has undertaken?
Chico State has always had this relationship with Chico, the city of Chico, because we are a residential campus. The majority of our students live within a 1 mile radius of campus. So it's a great downtown area where the students live. After the campfire and I went up to meet with the town of Paradise and their leadership, understanding what was happening and how inundated they were with requests for newspapers and documentary and researchers coming in, we were able to kind of make that formal partnership where they were able to direct people. And like I said, there was about 75 that from around the world that contacted me. And I think those were just the ones that kind of took that place or maybe wanted to connect with that university to get the perspective. So knowing where the town is and attending their meetings and going to their recovery processes, being on the long-term recovery board, establishing friendships and partnerships with all the agencies that exist inside the long-term recovery group has kept me and then others on pulse of where the town is for Paradise, which is further along in the process than the rest of the ridge that burned. Where they are in their recovery process. So when meeting with somebody or understanding where they're coming from with their research or their questions, giving them that local lens of what the town's perspective is before they head up the hill or before they dive any deeper into research has been a big benefit for that. And then relaying that back to the town of kind of who's in their backyard. Paradise is about a 12-mile drive from Chico State. So one of the biggest benefits is if I can get in the car, because I now have a 12-mile drive to establish the relationship, talk to people, be on the bus, look at these volunteer groups, the service learning, these undergraduate research courses that are action research based. That 12-mile drive is so beneficial because they come in and you're excited about what we're doing, we're excited about our ideas, but are able to kind of not so wide-eyed when they arrive and answering some of the, I'd rather be offended than getting off and somebody saying, why would anybody live here anyways? So being able to be offended for my neighbor is something that I can do and what the university can do. That answer your question? A little bit? Okay.
Can I, I'm a little envious that shield exists here. And that's, not to characterize it in that frame necessarily, but in some places in the rural West that are impacted by fire, they don't have a university in their backyard. And not only are researchers coming to look at recovery, they're coming to look at preparedness, they're coming to look at response, and so I think this question touches on a really valuable point, is that the impact of our constant need to know, which is wonderful, but is also can be a drain on communities, is something that needs to be considered. So any kind of interdisciplinary collaboration, like was talked about this morning, is much appreciated from the end user standpoint, both from being more valuable to us in the field, but also to minimizing its impact on us as hopefully partners, but occasionally subjects.
Winston Wong, member of the Roundtable on Health Equity. So one of the observations I've made being a California native and also previously being a Washington State resident, is the wildfires occur not in the population metropolitan areas of the state. And subsequently, the communities such as Paradise and the communities in Eastern Washington, my hypothesis is that they feel isolated from how these communities in the urban centers actually relate to the disasters that occur relative to the geography of the wildfires. On the other hand, there's trauma that occurs community-wide in these urban centers. So if you take something like in California, there's been trauma that affected Los Angeles relative to the unrest that occurred with the Rodney King unrest. And Western Washington, the Puget Sound, I'm sure there's been other activities relative to neighborhood violence and terrorism events, mass shootings, et cetera. Has there been ever any attempt to really identify the commonality between trauma that occurs in a situation where you feel geographically isolated and no one understands us below Sacramento, relative to what's happening in urban and highly dense communities as an issue of trying to build bridges and to break down the isolation that I think probably naturally occurs in any community that is victimized by kind of community-wide trauma.
Byron, you on the phone? I know. So I'm not aware of any specific look that's framed in that way. I think, though, that you are touching on a really critical piece there, and that is that resilience and our need to be broadly resilient, which is really what all of this is about, is disaster spanning. And so, you know, whether it be a Cascadia subduction event, tsunami, earthquake, geologic hazard, volcano, or wildland fire, east or west of the Cascade Mountains, this need for interwoven connections between us, innovative partnerships, and broad-based resilience is very common. And I think, ironically, it's the smoke that seems to cross the borders, particularly of the Cascade Mountains, so readily, that has spurred considerable amount of policy activity in Washington state, at least, because those larger metropolitan areas, while not necessarily prone to wildland fire, are certainly impacted by the smoke that has now become a routine part of our summer. So I know it's not quite an answer per se, but I think your question highlights the commonalities that need to start binding these discussions. This isn't a wildfire issue, this is a resilience issue.
There is also the cultures that have to be thought about when we're talking about the recovery too. The Woolsey fire broke out the day after the Camp Fire. So we were, my daughter and I left Butte County to get out of the smoke and drove towards the smoke of another fire. But there was also going back a couple weeks later to start rebuilding kind of Chico and being there for that community leadership piece. Even the understanding that somebody in another fire might have lost their second or third home versus a primary residence that is up in the ridge. And just those demographics that exist, sometimes those walls have to be broken down in compassion for each other in that. Even if it is a second or third home, it is still a loss, but it affects so differently than when it's somebody that has been on the ridge for 5 or 6 generations.
I want to answer your question also, because we're in Sacramento where this kind of work actually is being done. So Annie was completely right about the resilience frame that binds the two. Robert Wood Johnson Foundation recently funded a half-dozen cities, programs in cities, to take the concept of resilience, which has really been, or community resilience, let me focus it on community resilience, which had been fleshed out in work in the disaster field, and to try to establish its relevance and utility in chronic community stressors. So Sacramento, there's an NGO here, I'm not remembering the name, that won one of the awards and is working on violence, using the community resilience framework and theories and research to apply it to that chronic stressor. At the same time, there are communities that are trying to apply it to both a stressor as well as a disaster. So in the Gulf Coast, we know a community that's working to apply the concept to mental health unmet needs at the same time as they're rolling in disaster preparedness for future hurricanes. So I think that there is work to cite very practically on along what Annie said. Questions? David.
Thank you. I think this is on. So my name's David Hsu. I'm here representing NFPA, the National Fire Protection Association, and I just retired from CAL FIRE. And I'll be speaking later this afternoon about a lot of this, but the networks that we're all speaking about are specific to individual fires and responses. Now that we're unfortunately beginning to gather quite a long list of communities affected by these types of incidents, what efforts are being taken to maybe bind some of those communities together, lessons learned, such as I know when after the 2015 Valley Fire in Lake County, for example, and simultaneously in Calaveras County with the Butte Fire, we got conference calls going with the building and planning department officials in those counties who are now going to be faced with massive rebuilding questions, along with those same officials in San Diego County, for example, who had already gone through it. So I'm just curious how we're building those networks of communities and people who've already been through it. I know people from Coffey Park in Santa Rosa went up to meet with people in Paradise to share lessons learned a year later and things like that. So I'm hoping that there's more of that going on.
There is, and at multiple scales. And I think it's really important to recognize that this is a multi-scalar problem. We have, the work that FEMA's doing through the National Disaster Recovery Framework, the work that VOADs, the voluntary organizations active in disaster recovery, do. And so those sorts of programmatic knowledge sharing happens inside those organizations at those scales. Where it gets trickier is at the community level, and to see that sort of sharing happening at the community level. The National Fire Adapted Communities Learning Network, which I know there's a speaker who's I'm not gonna steal Michelle's thunder, she's gonna talk this afternoon as well. We'll talk specifically about that network. In Washington State, it's the Washington State Fire Adapted Communities Learning Network, where we are specifically looking at dispersing recovery best practices and knowledge gained through these experiences with one of our members, the Okanagan Long-Term Recovery Group, to make sure that those pieces aren't lost at the community level. That networking has a multitude of benefits. It accelerates the innovation and adoption of best practices. It reduces the isolation that many of these rural communities feel. It creates cross-disciplinary approaches. I mean, the benefits of this type of networking are many. After Gatlinburg, the fires in Gatlinburg, we in Washington State consolidated a list of local community organizations that were impacted and active in recovery, transmitted that through our governor's office directly to the governor of Tennessee to say, here's 1-800 phone a friend. Don't be afraid to reach out, because you don't know what you don't know until you need to know it. And I think it's really important that that connectivity and that networking happens at the community scale, and we don't necessarily have the institutions in place for that to happen consistently at the local level. And so it needs to happen at the state level, at the federal level, and through organizations, but also making sure that we can connect the mayor of Pateros to the folks in Paradise. That kind of connectivity is a real need.
Question over here.
Is it on? Yeah. Okay, great. Great panel, great discussion. Octavio Martinez, I'm on the Roundtable for Health Equity. One thing that I'm thinking about is before a disaster, we have many social determinants of health, of mental health, infrastructural, racism, a lot of issues that in fact marginalize many community members, right? However, when you take a look at a disaster, it affects everyone, and it's kind of an equalizing factor, and it's an opportunity to maybe do a reset. As you're doing your work and as you're looking at things from your perspective, how are you able to, if you have a model and approach to in fact ensure that those that have been marginalized, our communities, be too low SES or due to the skin color or their culture, whatever the case may be, to ensure not only are they getting an equitable response, not equal, but at least equitable, as well as maybe be included as part of the decision-making infrastructure that affects their community. So I'd be really interested to hear any kind of work you've been doing in that respect, including Byron, who's online.
Byron, do you want to start it?
Sure, sure. I would say that in my program, particularly the immediate disaster case management, whether by design or just how it happens, those individuals who are marginalized prior to the disaster tend to be the individuals that we are most supporting. In terms of the emergency management and the planning and the work, whether it's across ACF as well as the Health and Social Services Recovery Support Function, what we've done after disasters is really to actually live the whole community creed, if you will, partnering with the Centers for Independent Living, reaching out to the universities, the area agencies on aging, partnering and connecting with the trusted agents. I think there's, it can be a little difficult for me and for many of my colleagues from DC to come into a community as outsiders. So building those relationships with the faith-based groups, with the community action agencies, and giving them that voice. We stress a lot in HHS and ACF and cultural competency, social determinants of health, as well as social vulnerability are primary drivers for our leadership. So I think, within our sphere, it's one of the things that we have had to champion a lot. And I think we've had some successes recently getting FEMA and more emergency managers on board with that. We're not to the point where we're ensuring it, but there is a feedback loop. Some of certainly the concerns about whether or not, there's price gouging or some of the unintended consequences that might happen when one federal agency considers raising the fair market rate because of the disaster, recognizing that may then encourage other landlords to no longer want to participate in housing programs, recognizing that through FEMA they can get more money than they previously would have charged. Looking at some of the various eligibility criteria that's often tied to poverty or income across federal agencies. We've had a lot of conversations. I think the shortfall that we still have is that unfortunately we have been having these conversations each time there's a disaster. So every day is a new day. We've not reached to the point where we're noting that the issues that you raised and the steps that we took for this community to make sure that didn't happen, that we didn't institutionalize that, so we don't have to have this conversation again 30, 60, 90, 180 days later in another community. So it's not as structural as it needs to be.
I think that's a really important answer, and I'd love to see if we can get the next two answers to that, focused really at the opportunity at the local level, since this is really a structural issue. I think you're asking and the fixes have to start from rebuilding and policies at the local level.
Yeah, we in Washington State have been better at this, better at applying institutionalizing policies that advance equitable outcomes in the response framework, particularly after 2014 and 2015. There were poor outcomes in terms of evacuating migrant camps, farm workers. It was difficult in a lot of respects, both in terms of the short time frame that was available to the emergency managers, but also that there was no real systems or policies in place to ensure coverage, right? It was, anyway, so that being said, after that, Washington State Legislature passed a bill, substitute Senate Bill 5046 in Washington State was the bill requiring language access notification for emergency evacuation for what they termed significant population segments, 5% of the population or 1,000 people, whichever is less. And so this is a significant step forward that now, even now it's in policy, it should be done, right? There was no funding that came with that. It's tied to the update of local emergencies, comprehensive emergency plan updates. So many of them are still phasing that work in, and it doesn't guarantee effectiveness in implementation. So there's been progress made at that policy level. Where I think we're still struggling from a policy standpoint is in the preparedness and recovery pieces, where there's been less policy action, at least in Washington State, moving equitable access to those pieces forward. And I think One America wrote a white paper, I'm not sure if it's available online, looking at inequitable disaster outcomes in communities, kind of highlighting with respect to the Washington wildfires where we could advance our work a little bit more. So,
I think it's also important to look at when we're looking at these housing issues. Chico, the city of Chico did put a 10% increase cap on rentals for our apartments and our rental industry, or our rentals. And that did affect our students too, so how students are affected with getting their rent raised, and then just people that had rentals as kind of a second income that now needed that rental. So they secondary displacement was a big thing in those first few months, and it's still happening over the summer as students are moving. Have seen people that are not going to be renting again in the fall. We do have plenty of student housing in Chico, and there was kind of this big rush to see where all these beds were. So student housing really isn't an issue anymore, but it's that outside of that 1 mile radius around campus that we're seeing it. So we did put the 10% cap on, and only being 7 months in, that's what has happened. We'll see what happens again next year, if that will be there again. But when we're looking at what students are living in houses that were secondary, that were displaced secondary after the disaster, where they went, and that just creates the housing insecurity for those students. It seems like a normal narrative that college students should be sleeping on couches and like eating top ramen all the time, and that's kind of the story to tell. But it really creates, especially with the current generation in college and the levels of anxiety that they already have, and the disparity and the levels of first generation college students that are in college navigating this, creating this housing insecurity for them because of it that happens after a disaster needs to be identified, because it's just adding to their academic progress and being able to graduate on time.
The other thing that I just would add is that, you know, we are getting better at looking at equitable outcomes. But there, you know, we also find in rural parts of Washington State, at least, that our rural nature can be problematic to us. For example, Washington State in neither 2014 nor 2015 we didn't receive individual assistance from FEMA. We received public assistance, and FEMA has been a strong and vital partner. And so I know this is a bit of a sore spot when we start talking about the fact that we didn't receive individual assistance, but we didn't. And the reason for that is the damages weren't concentrated enough. The way that we provide that assistance has to do with an assortment of formulas, but our rural places sometimes are not receiving the same kinds of assistance that our more populated places are. And that's a lens that we don't always talk about. So.
Fascinating answers. Further questions? I have one question for the members. Yesterday we heard from Don Hankins about the importance of the land to bringing solace to individuals and communities. People live in the wild lands for a purpose. Many purposes, of course, but one of them is to be among the wildlands. It's very different than an urban situation or choice in that regard. So what are the opportunities for using that attachment to nature, to land, and specifically to wildland recovery programs that might be being done? What are the opportunities for connecting those recovery programs to community recovery, mental health recovery? Could you tell us a little bit about that?
The connection for that, and one of the slides that I wasn't able to show was through a listening session with the community on the Ridge, and this was specifically with Paradise. And it shows the top 10 elements of what the benefits of Paradise were and where they saw opportunities for progress or how they could make it better. They wanted what they had, but they wanted a little bit better. And if you look at those top 10 things that people loved about Paradise, it was that environment and being around the trees, and what people missed the most, the dark sky at night, and what that was impacting their mental health and their sense of place. And so I think that there's an important place to look at what forest therapy can do for people that have experienced disasters, especially wildland disasters for fire, that to learn not to be afraid of the places that you want and love to live, that to understand how being in the trees helps you, how being in the forest helps you, and that we need to have that piece of it. So forest therapy has a part of this resiliency when we're talking about the aftermath of a fire and how to recover from it. And when we're looking at what academic institutions can do is to have that cross-disciplinary approach with how we're looking at the mental health and the public health and using this parks and recreation piece and looking at more of the social sciences coupled with these other parts of recovery. We do have at Chico State is fortunate enough to be in a rural area, and we do have acres of Butte Creek Ecological Preserve and Reserve. And so we have a few thousand acres to use for some of this purpose. Some of it does have burnt land on it from the campfire. And so our director of the reserve, Eli Goodsell, he was able to secure a K-12 grant to bring children out to the reserve, show them about fire. He works with Don Hankins at Chico State. And then also use that time with the students, the K-12 students at least, to talk about the benefits of the land and being in the land. And these are students that lost their homes to the fire. So exposing them to fire in a healthy way, getting them back onto the land that they grew up in and being in that, and then also changing their frame of reference to how they live and how they need to live in the places that they want to live in these rural areas.
I think it's critical too that communities and having the sort of storied fire history that we do in North Central Washington, we have photo points from earlier fire seasons. The 1994 fire seasons were substantial in Washington State, 1988 fires in the Aniat drainage. And so a photographer by the name of John Marshall established a series of photo points with some federal funding to track landscape recovery post-fire. And so those photo points provide us an opportunity to show residents in similar ecosystems that the landscape will recover, to try to show that series of and progression of return to a vital and beautiful landscape. And so I think that there are materials and resources out there that was actually a piece of the After the Fire toolkit that we didn't develop fully, but that material has been consolidated and is I told David yesterday that these types of conversations were making me want to resurrect that work. But the other thing I think we have to be very careful of, and I think Don would say the same, is that we can't marginalize fire in our ecosystems and in our the coupled system that makes up our existence, social and ecological systems. Fire has a role in these fire-adapted ecosystems, and it's very difficult to talk about that in the framework of recovery. But just as we look at the landscape recovering, we have to look at the return of fire to that landscape and what that means for those communities, for the ecosystems that thrive with fire. And so it's a tricky balance between those two things, but fire has to be part of the conversation, just as Megan mentioned.
1 minute or one more question?
We have a question from the web.
Oh, please.
Universities are anchor institutions. How would the anchor frame apply to the role of universities after a wildfire or other disaster in responding and building resiliency?
I think that's what we're trying to decide and kind of where that in levels of institutions. So Chico State has a great partnership with our community college, and we just have one nearby, but other institutions often have several community colleges nearby. And then finding where our closest UC, for us it's UC Davis, and then looking over at Cal State, Humboldt State. So how we already use the campus systems that we have in place, in California especially, where there's 23 CSUs from San Diego all the way up to Humboldt. They are already these anchor institutions in the state. You can kind of plot your way through California by visiting the UCs and the CSU system. So those systems are already in place, especially in a state like California, and then you implement these smaller the community college systems into it. I see how this pipeline of education, first of all, the K through 12, into what we need for the community colleges, kind of pumping out the middle class from the CSU system, and then continuing this relationship with the UC system for some higher level work as well. If we can see our education systems in the system approach to it as a place where communities that are close to institutions can use, one, just right off the bat, because that is where their host community is, but then also after disaster. I was able to take our FEMA data for California and lay over our 23 campus map of California to see how many residents were displaced near a CSU system or a CSU campus. And when you think that they are already so connected to Chico State, and now there's about 2,000 living within just like the Los Angeles area, and how many CSU campuses are there, they're already connected to kind of that state idea, that campus state. So to get those survivors from Chico and Paradise to Fullerton, to have community listening sessions, to be able to use that system and support each other within that, I think that would be a great place to start with it, to develop with our chancellor's office and president's office to get that going. So we have long-term recovery inside of our CSU and UC systems.
I'm mindful of the time. I think we've come to the end of a really fantastic set of comments and questions and speakers. We are due to, we have a break now, and we return at 11 a.m. Thank you very much.